Well, ZH Healthcare is a health IT company, as the name suggests, right? So it was started with a concept of delivering health IT to as many people as possible and to make it really affordable. So we started the company sometime in 2008, July 2008 to be specific. And initially we started out as a medical billing company, so we should get some cash flow going. And we were looking for software, and we discovered that the software for health IT is really expensive, and people were charging whatever they wanted, and it was very siloed, the information. So, so this idea germinated that we need to do something about this. So we were looking for open source software that we could contribute to and make it popular, and then we found out OpenEMR. OpenEMR was a very small project at that time. It was a few years in the making, but we started participating in it and we started contributing to it. And over a period of the next 8-9 years, we found that it grew from an obscure open source project to a very popular, in fact, the most popular open source EHR system in the world today. Over 1,500 people are downloading it every week. Over 300,000 downloads occurred so far. So, and it's being used in over 200 countries right now. It's translated in 36 languages. So once we started participating in OpenEMR, we discovered that people are not using open source EHR just because it's free. The whole point was that it was very, very flexible. People like the idea of the flexibility because health IT needs is not just one size. It's different sizes, different permutations, different needs for different sectors of the health industry as such. So, and most of the products were just bent for one vertical or the other, and nobody was taking care of the other pieces. So all these requirements came to be fulfilled by open source EHR systems. And so we came up with this idea that why not provide this extreme flexibility that open source provides on a cloud platform, on a system where the end user had to do very little, and they could just configure the systems as they came in and then execute on that and deliver their health IT solution in a very cost-effective way. And therefore, we started what is now known as Health IT as a Service, which is Blue EHS. Well, good question. And like I said earlier, the requirement for health IT has different hues. There is a requirement, for instance, there's a requirement for an EHR system that is unique to sleep study centers. There's another that is unique to de-addiction centers, or there is a need for a certain country's laws and requirements. There is telemedicine requirement, there's payment, online payment platform requirement. So if you start looking at it, there are verticals, there are apps, Internet of Things, all these things are a necessary part of the entire ecosystem of health IT. And those things right now are so fragmented that people have to reinvent the wheel each time they are going to configure these solutions. I'm calling it configuring because people use the term development, which is not true because they are developing something that has already been developed. So I would rather say that they are configuring these systems, and we wanted to provide a platform where all the tools that are required to make a health IT solution is available online. So why should people care about this? Because they have the ability now to create their own solutions at a fraction of the cost. Now imagine if you were to develop something from scratch, which is what most people are doing now. They have to spend millions of dollars in development time. Secondly, as I was saying earlier, health IT is not just a software, it's an ecosystem, it's part of a network. So you have to have contracts with various players in the health IT industry. So for example, laboratories, you have to have interfaces with these people. So getting an interface and then setting that live takes time. The contractual agreement, the testing and other things takes time. So we are providing all these things together to a person who wants to come and do this thing so that they can have their solution out in 1 month. So we are cutting down the time, the effort, and the money that they would require to provide a health IT solution to 1/10th or even 1/24th of the time they would have otherwise spent. That's why it is important. Secondly, and most importantly, the ongoing costs of doing this. Because we are a platform, because we have this thousands of customers using this, we are able to cut deals and we are able to bring down these solutions, even in terms of support, even in terms of development, terms of new features that they are using. The cost comes down, which means it becomes more accessible to people. That's why it's important. So the question is the verticals that we are targeting, and the international piece. So let's talk about the verticals. Right now, we have a generic product which is called Blue EHS Clinics that is specifically for outpatient clinics. So any doctor, I mean every doctor, and I think that's the maximum number of doctors practicing outpatient clinic across the world. They require certain basic features, and Blue EHS Clinics is supposed to be doing that. So it has a scheduling piece, it has an EHR piece, it has even a billing piece, pharmacy, radiology, all these pieces. So we have a generic program that will be catering to almost all the generic practitioners out there. We also have a hospital management system that we have developed, which is for HMS. Specific verticals, if you look at, there's a $35 billion industry in the US alone called sleep study. So everybody is gaining weight, they're fat, and they're snoring. And so the health is adversely affected because of this sleep apnea and other things. And that market is expanding, and there's no EHR that caters to that particular market. So we have a product that is finely tuned for that particular industry, which takes care of the needs specific to that industry. So we call that Blue EHS Sleep Study. We have another vertical that we are already targeting is the long-term care market, where you have people staying in long-term care houses where they are being taken care of on a chronic basis. So we have that as well. So these are the two things that we have already targeted this year. And the next year we'll be targeting, we'll be expanding on the hospital management system. We have another product that is on the pipeline is our patient portal, which we are going to open it up to the public. So far we have thousands of doctors who are using the patient portal to reach their clients alone. Now what we are going to do is we are going to bring general public to these doctors so that the public can come and fix appointments and talk to these specialists that are already using our system. So that would become sort of like an appointment booking and video consultation piece of this whole solution that we have. 40% of our new signups are coming from outside the United States. So, like I said, each month we are having thousands of doctors signing up. In fact, the last month we had about 1,100 doctors signing up to our system, and 60% of that came outside the United States, from countries like India, the Middle East, Africa. So we have presence in all these countries. And again, this goes back to what Health IT as a Service is, the flexibility. So the system is so flexible that we have fine-tuned the needs of each individual country into the system. So if you go into the if you go into the Middle East system, you'll find that it is in Arabic, and it has a lot of features that is required for the Arabic population. Secondly, we have also established contracts with local clearinghouses and local e-prescription companies in, for instance, Dubai, which we have started doing that, and there are practices in Dubai who are starting to use the system because we have localized it to such an extent. We are very excited because, like I said, health IT requirements are huge. The actual use of electronic health record has only uh, taken place in the developed countries, mostly in America and partly in Europe. The rest of the 7 billion population don't have access to these things. That's number one. Number two is the fact that most of the hospital management systems or clinical management systems do not focus on the clinical side of the patients. They focus mostly on the accounting side of the patient. Even if you look around, all the major innovations and the money is being pumped into things that are kind of like what we call B2C kind of systems, where, oh, can I fix an appointment with a doctor? Can I do this and can I do that? It's not necessarily focusing on how you can improve patient outcomes. And those companies are very small. And with Health IT as a service, we are trying to expand on those areas, not just the areas that are, for lack of a better word, sexy, or well, let's call it popular in a public way. What we want to do is to bring the clinical aspects of health IT to the public. So, for instance, if your family has to store your entire medical record, right now you don't have a way of doing that, because you don't have access to all your medical records. You must have, any average person have seen at least 10 doctors in his life by the time he's 25, 30. So he has seen his pediatrician or specialist or dentist, all that. But you don't have all these medical records with you, and there is no way that you can bring it all together and store it in one place. We are providing that through our MyDocs portal. So MyDocs portal allows you to bring in your medical records in whatever form they have. You have a PDF form, you have a highly advanced structured CCDA document, or you have an XML document, any images, you can bring it all in and put it together. And if it is put rightly, what you can see is your timeline in a very graphical way as to your and it will be like a picture in front of you as to your health incidents during your lifetime. After all, what is electronic health record? Electronic health record is a longitudinal record of your health incidents. So it need not be negative incidents, it can be good incidents as well. So that is what we are trying to bring together in one aspect. That's what I'm saying. We are going to be focusing more on the clinical side of things, while we will be doing a lot on the area where we can connect patient to doctors. But our focus, and we are going to be focusing as a primarily an electronic health records company. We are a serious company in that aspect. I think once I said in a speech that being an entrepreneur is a tireless need to be abusing oneself. I mean, in the sense, for me, uh, it was actually an excitement to do something new initially, and then I entered into different aspects of entrepreneurship or started different companies. Let's call it that. Uh, because I was opportunistic. I saw a need, I saw that something was there, and I took that opportunity to do something on that aspect. So I started out as a lawyer, so you will see that in my narrative. So when I started out almost 30 years ago as a lawyer, and then the stock market was booming at that time, and my family had taken a stock broking membership in the Cochin Stock Exchange, which is in India. So I was born in India, needless to say. So, so in the stock market, and it was the time when India was liberalizing. So that there was a big stock market boom, and I rode that wave initially. I made a lot of money. So I dropped my law practice and I focused on that. During that piece, we needed software for the stockbroking business. So I invested in a software company, and therefore that is my first introduction to software. And that software company got a lot of requirements from hospital systems at that time, which was booming in Kerala. Because, and even now, I think Kerala has the maximum number of hospitals and super specialty hospitals if you look at India as a whole. So we started working on hospital management systems. So that was my introduction. Along the way, I started 7 different companies and I exited from a few. In In between, I had done a small stint in Saudi Arabia where I actually lost money. And then I came to the US sometime in 2003 and I established a couple of companies. Uh, so let's step back here and look at it. And when I started ZH Healthcare and when I got involved in the open source software scene, I realized that I found my passion. That the passion was to deliver healthcare IT to people, and I am so excited about this. I eat, drink, and sleep this thing right now. So that's my evolution as an entrepreneur. Having done so many different things in different areas, realized health IT is what I want to do. Right. So July 2008 we started. We were just four of us. Myself, Shazad, who is the CEO of the company who runs the Indian operations, Leila Genie, who is running the medical billing division, and a co-investor was my sister, who is a doctor, and who realized that this is important. Um, Right now, the company has over 120 people and still growing, and we are adding about 4 to 5 people every month currently, and uh, probably by the end of the year we'll end up with 200 plus people on that. Um, so the growth rate of the company has been amazing, and it is it's amazing when other people points it out to us. I mean, we thought that we were not growing big enough. We have been growing at around 80% year over year. That is a cumulative growth rate that we have seen. Uh, and so when people say, "Hey, you have done well," and I'm like, "Okay, but we haven't done good enough." And so what we are looking at is to, and you will see that kind of aggressive projections in our growth projections for 2016 as well. We are looking to grow at least 3 times by the end of the year. So um, that's where we want to go. We have a great advisory board. In fact, we are very happy with them, and the people are. So it starts with Rodney Lake, who was one of the first members of the advisory board, who helped us tremendously. And Rodney Lake is a professor at George Washington University. He's the principal of Benwell Group. He managed the $1.5 billion fund. And then we have William Lane, or we call him Bill Lane, vice president at Credit Suisse, and they manage billions of dollars for wealthy families and institutions. Apart from Bill and Rodney, we have Mark Hasenplug, who has been a strategic consultant to Fortune 500 companies. We have Sid Pandit, who is one of the foremost IP lawyers in DC. We have Jude Pierre, who is a well-known physician, a very, very earnest open source aficionado. In fact, he himself had invested in open source software along uh, with when we did with open source EMR. ZH, we are very proud that we have been able to make a mark in an industry where money has talked a lot. Everybody that who we are competing against has a war chest of 50 to $100 million, and we have made a mark. In fact, we have survived and we are thriving in a market uh, that has so much money. So what it shows to me is that it's not just money that is going to make a difference in this market. It is your product and your approach, your service approach. And I have found that, and what we as a team has discovered is that there are lots of cost effective ways to build and run a company and make it flourish in this era where everybody is looking for VC funding and everybody is saying we've raised so much money. We don't think, of course, I'm not saying that money is not important. We think that we can do a lot with very little, and we have shown that, and that is why we say that we have grown that at 80% in the last so many years, and we feel that we can go a lot more with very little, and we are confident that we can reach our goal of making IT, health IT affordable and accessible to everybody.